Fredy's our Chief Program Officer at Catholic Charities, serving people in 8 counties here in Northeast Ohio. Fredy, how do you weave together responses for people in mental illness that include professional support, social support, relationship support, and somehow weave all those together at the service of the person and the family? It always involves the family at some level. How do you weave all those together, keeping that person, their dignity, right at the center?
Thank you for this one. Thank you for being here. This is truly an honor, and I feel energized by today. I think we all are getting a shot of hope today, and hope is always welcome. The question is, how do we respond as a system? And we all know that all of us as people are complicated, right? We have complicated lives, complicated needs. So the last thing I want to do is to give you a simplistic answer. We have the answer for that. We have the answer here. But what I hope to give you is an overview, brief overview of the interconnectedness, to answer your question, with the professional clinical services, the social connectedness that's needed, and the accompaniment piece. I think many of you know Catholic Charities is a large system of care, and about 25 to 30% of our programs would be categorized in the behavioral health field. We cover a whole spectrum of services, from the least intensity of prevention services to residential treatment. We have a facility in Parma, Ohio, 108-bed facility, Matt Talbot, and we cover the full spectrum in between, outpatient, intensive outpatient, and such. All that is important. Clinical work, clinical interventions, clinical work is important, and if I didn't feel that way, I wouldn't have gone into the field. It's important. Why? For a number of reasons. Sometimes all of us need to make sense of our situation, and we need an outside person to help us contextualize what it is that we're experiencing. That's where clinical interventions come in very, very handy. That's where the clinical relationship that's established in a professional setting has those boundaries, and it can really create a space for growth, for skill building, for improving our lives. But sometimes that's not enough, right? We recognize that all of us have many different needs, and as a system, we have been very intentional at creating opportunities for social connectedness. We have been very intentional at creating places for community. And I'm going to give you a few examples of that. For example, at Matt Talbot Residential, we have, for a number of years, an alumni group. Everyone that completes the program, that is working in their recovery, they're always welcome to come back and celebrate. So what has happened over time is that there's a recovering community that finds strengths in numbers, finds strengths, as Jonathan alluded earlier, he found strength in being able to make sense of his situation by hearing from others. How are you doing? What's working for you? So we are intentional about creating those safe places. We operate 3 family centers, one in the Huff neighborhood, one in Glenville neighborhood, and one in Euclid. If you're familiar with our family centers, you know that these are places of community where kids, teens, adults, and seniors come on a day-to-day, and these are community hubs. All people are welcome. Why is that important? I want us to think and understand that all of us here in this room, and really all of us, are hurt in relationships. Whether it is the absence of a certain relationship, whether it's the lack of attachment to, I don't want to get too clinical, but we're all hurt in relationships. But guess what? we all heal in relationships too. We don't heal in isolation. In fact, the quickest way for emotional decomposition is to put somebody in isolation. And we experienced some of that. Dr. Dave reminded us of the pandemic and the isolation that we all experienced during COVID. Remember how terrible that was? How we couldn't even visit our loved ones, right? And I was always worrying about my parents, and they were worried about me and my neighbors. And isolation is the breeding ground for just emotional, mental decomposition. So as a system, we have been intentional in creating places where community can happen. Our Hispanic Senior Center, if you're ever having a bad day, oh, that's what I do. I make a site visit, Wonderful, wonderful seniors there, listening to music, laughing. Cosgrove Center, some of you, if you're from Cleveland area, you've heard of the Cosgrove Center on 18th and Superior. We serve about 500 meals a day and serve the unhoused population in downtown Cleveland. But Cosgrove Center is more than a food meal and pantry place. It's a place where people know your name. Okay, kind of like Cheers, remember that? If I need a shot of hope, I go to Cosgrove Center because I'm there in a place of community. And, I'm honored when I'm recognized in places like this, and thank you, but I'm more honored when I go to Cosgrove and people there remember who I am because I remember who they are. Places of community is where healing occurs. So as a system, Catholic Charities, yes, we have a robust amount of clinical programs that we offer throughout the 8 counties, but intentional about creating community. Then the third piece to this is accompaniment. And we have heard all day and have heard of many different examples of how that happens. I think accompaniment is directly connected to honoring people's dignity. Because one thing that all of us, when we experience dignity, is we are seen, we are heard, we are understood, and we are valued. So let's reimagine a system of care where professionals can offer the professional services, and we have an abundance of places of community where natural connections can occur and healing begins. And then we have an army of wonderful people like the ones I'm looking at right now that are saying, this is not their problem, this is us. We are a community and we want to help. I think that's the kind of system that I want to be a part of. And the only way to create that is by continuing to do the work that is happening today. And I don't know how I'm doing with time, so but I am I'm excited for what is happening here at St. Ambrose, but also what I see happening at other parishes. And our work with the parishes, and not just Catholic Charities, but really understanding that there is no division, there is no them. It's us. It's us. Thank you.
Thank you, Fredy.